Nothing buys older people as fast as when they take a fall and break a bone, break their hip, osteoporosis and things like that. It goes downhill from there. You see a man, a woman that is doing perfectly well, and you hear they fell from the stairs or one type of fall or the other. If you have worked in a nursing home, you know what I'm talking about. And then it goes downhill from there. It's like most of the time they never recover. Why is that? Because their bones are brittle, their bones are frail, their bones are weak, so it can easily break. Osteoporosis. Okay, so what is the one thing that helps the bones? Calcium. So you can get your calcium from food, depending on your age, your diet, and your health. Some people may need to supplement. That means taking calcium supplements. Okay, but there's one thing I want you to know when you're taking this calcium supplement. Calcium does not work alone. If you're thinking about taking calcium, you must also think about vitamin D. I'm going to explain it in a very simple form. Calcium is kind of something that's standing outside the door, the house being your body, okay? Vitamin D is what opens the door for the calcium to enter. So if you have calcium and the vitamin D is not there to open the door to allow it to enter, you see that you may not have enough calcium as you would have if you have this door opener, okay? And once that vitamin D enters your body, there is something else, vitamin K2. Vitamin K2 is important because I like to think of it as the butler or the maid in the house. So vitamin D opens the door, calcium enters. Vitamin K2 is the butler that helps the calcium to go where it's supposed to. Basically shows the calcium in the visitor's room or wherever they're supposed to go. Otherwise, calcium can end up anywhere. It can end up where it's not supposed to end up, like in your vessels, your arteries, your blood vessels. And we all know what happens if you have too much buildup in your blood vessels, too much plaque. It can break out and cause a blockage. And when a blockage happens, if it's in the brain, it's a stroke. If it's in the heart, it's a heart attack. We all know that already. Okay, so we're trying to prevent any buildup as much as possible. So we don't want calcium going there at all. So vitamin K2 helps calcium to go where it's supposed to go, which is your bone and your teeth. Those are the only two places you want calcium to be. That's where they're needed to give you strong bones and strong teeth. So that's what vitamin K2 does. Okay, so we've talked about calcium, we talked about vitamin D, and we've talked about vitamin K2. There's also one more vitamin I like to mention. That vitamin is kind of the brain behind the scene. It helps all these cascade work together, and that is magnesium. Okay, so if your magnesium helps to activate vitamin D in a way, yes. So that's the best way I can explain it. So if you're going to be taking calcium, if you care about your bone health, make sure you're consuming enough calcium in your food. And if you and your doctor decide to supplement, taking supplementation, also make sure you guys discuss and consider vitamin D, vitamin K2, and magnesium. All these things work together for those who trust in the Lord. Don't mind me, I'm being funny. So anyway, I wanted to talk about that. But the reason I always mention your doctor is because I don't want you to think everything is all fine and dandy, because people have by themselves from lack of knowledge. If you are taking a blood thinner, warfarin, and the likes, let's say you need to take it for another medical condition, you might have to be careful with vitamin K2. Okay? So again, that's why I keep saying discuss with your doctor. But if you're healthy, otherwise, most of the time, you should be okay. You still need to know your levels so you don't take too much of anything when you have enough. Okay? Thank you all for watching. Until next time, I hope this helps somebody and this clarifies a few things. And if you did, don't forget to give us a like, share with your loved ones, drop your comment down below, and I will see you in my next video. Bye-bye.